friends. Today we are going to discuss about motivational enhancement therapy. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about motivational enhancement therapy, motivation interviewing, and how it is related to motivational enhancement therapy will be discussed, procedure of motivational enhancement therapy, process, predictors of motivational enhancement therapy will be discussed. Finally, the steps used in motivational enhancement therapy, frames and dares will be discussed in this video. Let's understand motivational interviewing first. Why we should use this? Invariably, when a patient goes to a doctor, the doctor wants to bring in changes in patient's life. It can be reducing weight, taking medication regularly, coming to follow up regularly, going to do exercise regularly. Invariably, the doctor believes the patient has come means he is ready, willing, and will be able to make change. But unfortunately, this does not happen. Simple advice will not bring in any change in patient's life. The simple reason is the patient may lack motivation, or else he may not be empowered how to go about doing changes. In this regard, many a time these advice remain as an advice rather than bringing in change in patient's life. Simple reason is weight loss is very difficult, and many a time the patient do not know. Stopping alcohol use, stopping smoking are just being given as an advice. The patient do not have skills to stop them. Hence, by giving advising or lecturing will not help the patient or the client. Hence, motivational interviewing was introduced. This was first used by Miller and his colleagues. Here, the motivational interview, specifically I'm using interview, is normally a brief 15 to 30 minutes intervention provided in one or two sessions, either inpatient, outpatient, or maybe in the office. It is delivered as a freestanding intervention when the person has to make change in his life, or else it can be prelude to other treatment or therapies. For example, the patient is refusing to do cognitive behavioral therapy. Invariably, the motivational interview will be the first before he enters into CBT. Hence, motivational interview is a approach or else a technique or a skill used before various other treatment. Invariably, there are various adaptations has been done. Miller has brought in various changes and adaptation. That adaptation is motivational enhancement therapy for alcohol use. It operates on the belief that client possess their own internal resources to overcome the substance abuse. Motivational enhancement therapy utilizes motivational strategies to activate the motivation, maintain that, mobilize their resources, facilitating meaningful change in their life. Invariably, it combines us both personal feedback from the assessment and also providing empathy, giving complete autonomy to the patient, and believing that the patient has resources to deal with his own problem and the therapist will guide him to overcome the problem or bring in changes in his behavior. In this regard, the therapist in motivational interview or in motivational enhancement therapy, he will never say, I have what you need. He will never say that I will cure you or I will treat you. But instead, in motivational interview or motivational enhancement therapy, the therapist will say, you have what you need. Together, we will find it or explore it. That means it is a collaborative work between the therapist and the client to explore the resources of the client, engage him, provide empathy, help him to find his own goals, uncover his resources, and help him to bring in change to overcome his unwanted behavior. In MI, the strong emphasis is given in eliciting the client's own perception, values, and resources to bring in change. This is done by Socratic fashion of questioning. Invariably, open-ended questions are brought in to uncover the resources he has. The role of therapist is to bring in change through intrinsic motivation rather than extrinsic motivation. If you look at this, how the motivation works. On x-axis, you can see the motivation. On y-axis, the time. Invariably, in sometimes the motivation will be on the top notch. That means during this top notch, the behavior will be at its best. But unfortunately, it also has a downs. During this period, there will be relapse and lapses do occur. That means we need to understand motivation is not a continuous process. It is a dynamic in nature. It has fluctuation, ups and downs. Hence, you need to understand that there will be relapses in substance use or behaviorally change process what we want to bring in. Hence, my dear friends, invariably the expectation is the green. That is, everybody wants to expect a person to improve with motivation over a period of time. But that doesn't happen. Invariably, in reality, the motivation fluctuates. At time, it's very high and the behavior will be at the best, like stopping alcohol and substance use. If something goes wrong in his life, he may have a relapse and the behavior recurs. Hence, as a therapist, looking at this graph, expect relapse, explain the family members, and also to the client. There is lapses and relapse, but coming back for the treatment so that the motivation is at the top notch, so he can overcome the substance use over a period of time. Let's understand the definition of motivational interview. MI is defined as a person-centered, goal-oriented style of communication with particular focus on the expressions of change. The goal is to increase personal motivation for and commit to behavior change by eliciting and intensifying person's own reasons for change in an atmosphere of acceptance and empathy. This is very complicated. In simple word, here the patient or the client will find reasons for a change to give up his unwanted behavior by identifying his own resources and bring in intrinsic motivation in an atmosphere of acceptance and empathy provided by the therapist. The first person who brought this framework was William Miller in 1983. He discussed about motivation interview. Over the period of years, William and Stephen Rolnick expanded and broadened the original concept of motivational interview and introduced motivational enhancement therapy, that is the adaptation. Motivational interview is used initially for the purpose of substance use like alcohol, tobacco, and drugs. Later, it has been adapted and adopted in various chronic medical conditions requiring behavioral changes, such as doing exercise daily, coming for treatment, taking medication regularly, going to follow up regularly, and various other behavioral changes which is required in chronic medical conditions. Invariably, research indicates motivational interview will play a crucial role when a patient is less motivated, not ready for change, who are more angry or opposed for change. In those population, motivational interview plays a crucial role. Further, action-oriented counseling with the goal of behavioral change is likely to evoke resistance and reactance to change. That means if you use CBT in a patient who wants to give up alcohol or who does not wants to give up alcohol, invariably there will be resistance and he may not come for therapy. Hence, from a trans theoretical perspective, the therapist need to understand there is a mismatch between the stage of changes or a change where the client is there, either he is in contemplation or maybe even in pre-contemplation, preparation, action, and maintenance, or he may be in relapse, which was given by Prashaka and DiClemente in 1984. In this regard, the motivational interview needs to be understood from the perspective of as a skill or a technique or an approach for a behavior which needs to be changed. Whereas motivational enhancement therapy is an adaptation of motivational interview. To understand and learn about motivational enhancement therapy, there is a manual available online. Please do scan this QR code and download this manual. This is a very important manual which discusses how motivational enhancement therapy can be manualized, what the therapist should know, and how he needs to bring in behavioral change in the client. If you look at this picture, it clearly indicates motivational enhancement therapy has three important components. One is motivation interview by itself, which is structured and time limited, and frames approach is usually used is in MET. That means motivational interview is one of the ingredient of motivational enhancement therapy. Invariably, many clinicians believe motivational interview and motivational enhancement therapy both are same. But if you look at the finer aspects, motivational interview is an approach and it is used in motivational enhancement therapy. Interview is invariably used anywhere, any place, anytime, either in inpatient or outpatient. Whereas motivational enhancement therapy is a structured therapy requiring 4 to 6 sessions, and invariably frames approach is used. Let's discuss about motivational enhancement therapy. It is a therapy which has a systematic intervention approach for evoking change in problematic behavior such as alcohol use, smoking, weight loss, and so forth. It is based upon the principles of motivational theory, motivational interviewing, and it is designed to produce rapid and internally motivated change. Invariably, motivational enhancement therapy is given in 4 to 6 sessions, carefully planned, and individualized treatment sessions are given. The first 2 to 3 sessions focus on structured feedback from the initial assessment, future plans, and motivation for change. Final 2 to 3 sessions at the midpoint and the end of the treatment provides opportunities for the therapist to reinforce progress, encourage reassessment, and provide an objective perspective on the process of change. So invariably 4 to 6 sessions are given in motivational enhancement therapy. Let's look into the principles of motivational enhancement therapy. It is a person-centered approach. It respects the individual's autonomy and emphasizes collaborative, non-confrontational communication. That means you will give complete autonomy to the client and he will decide which is his goal, how he will approach, and he will uncover his own resources by the help of the therapist. Invariably, it will be non-confrontational and non-lecturing basis. Invariably, Socratic questioning will be used. Enhancing intrinsic motivation is the second important. It focuses on helping the individual to recognize and resolve his ambivalency towards change. Here, the client has to do his work in where the therapist will guide him. Therapist will not give ready-made solution. He will not lecture him. The therapist will guide. That means it's a collaborative work. Rather than the therapist is not at the higher power. It is at the equal power. In CBT, the therapist will say, I will uncover your cognitive distortion. I'll be able to tell you your whatever automatic negative thoughts, and I will help you to do things. I have answer for your problems. That is what is CBT. Whereas motivational enhancement therapy approaches in a different way. It says it's a collaborative work. You have to decide about your change. You have to uncover your resources. And I'm here to help you to do that. It is a collaborative. That means it is an equal power in equation with regard to motivational enhancement therapy. Again, in MET, it talks about empowerment of the client, and self-efficacy is very essential. Hence, the therapist will build confidence in the client and brings in sustained change to leave the unwanted behavior. Guided discovery is the what the therapist does. Therapist will use open-ended questions, empathy, reflective listening, affirmations to help the client to explore their own values and motivations to change. So these are the four important principles in motivational enhancement therapy. Let's look into the key goals in MET. The key goals are increased awareness about the problematic behavior like alcohol use, substance use. Here it is not done by giving lecture. Over a period of time, the therapist will guide so that the client himself will recognize. Enhance motivation by highlighting the gap between the current behavior and the personal values or goals. Invariably, the client realizes to reach his goals, he need to do certain behavioral changes. In one of the behavioral change will be giving up substance use. Foster commitment to change through personalized feedback by the therapist. Therapist will make sure to promote self-efficacy by emphasizing client's ability to succeed in his journey to change the behavior. What are the procedure in motivational enhancement therapy? As I mentioned earlier, it is a time-limited 4 to 5 sessions, each session lasting for 45 to 60 minutes. Invariably, it can be protocol-driven. MET is primarily on enhancing, maintaining, and bringing the behavioral change to remove unwanted behavior. Invariably, in the first 2 to 3 sessions, significant others can be involved. It can be parents or a spouse who wants to help the client to overcome his unwanted behavior. In the later part of the session, that is 4 to 6 session, we need to avoid involving the significant family members. Simple reason is the client needs to identify his own resources. The simple reason is intrinsic motivation should be established. Hence, in the initial period, the significant others can be brought in, or you may not bring them. But in the later part, the client and the therapist will collaboratively work together, not to bring other family members in the later part of the sessions. Let's look into the session 1. Usually it will be assessment. That is gathering baseline information on the behavior patterns, consequences, and readiness for change. Detailed evaluation for the unwanted behavior. It can be alcohol, it can be drugs, it can be poor weight gain, obesity, poor adherence to treatment. Session 2 invariably focus on building rapport and providing feedback. In providing feedback, he will take all the investigations such as blood test, liver function test, renal function test, hemogram. Here, the doctor will provide a personalized feedback looking at his assessments. It can be telling that look at your liver function test. They are dearranged. The possibilities are ABCD, and in your case, it appears because of alcohol use, this liver function is altered. During this period, invariably, the advice should be avoided and to be given as a feedback for the here and now the problems has occurred. Avoid giving lecture telling that if you continue to drink alcohol, cirrhosis will develop. These kinds of should not be done. The simple reason is in motivation to enhance, what are the problems at hand now that needs to be addressed rather than taking the problems in the future. And one need to explore his ambivalence towards change. Why he would like to continue to use alcohol, what are the positive aspects and negative aspects of continuing using alcohol, and whether he would like to give up or not. Encouraging the client to express his concerns and goals is very essential. You need to ask the client what he wants to do in his life, what he wants to achieve. Those goals needs to be important end outcome which you need to discuss with the client instead of focusing on the substance use. Although the motivational enhancement therapy is to bring about change to remove the substance use, but you are going to change the approach from focusing on the goals of his life rather than focusing on the substance. In session 3, he will talk about enhancing his motivation and developing discrepancies, helping the client to recognize the inconsistencies between the current behavior and personal goals which he wants to achieve. You need to strengthen his intrinsic motivation by discussing the pros and cons of changing versus maintaining the behavior what is continuing. Whether the person wants to be in his comfort zone or would he likes to move out to achieve his goals. Session 4 is strengthening the commitment and planning for change, supporting the client in identifying the change strategies, developing the change plan with specific achievable goals, that is a SMART goals, which can be brought, which are specific, which are identifiable, which can be measurable, and those kinds of goals will be kept. And invariably, therapists need to reinforce self-efficacy, improve the client's self-esteem and coping strategies. Session 5 will be consolidating and preventing relapse. The therapist will review the progress, address the barrier to long-term change, strengthening coping skills and building relapse prevention strategies, emphasizing continued self-motivation and resilience. In this process, you need to discuss with the family members that relapse and lapse could occur. Please bring him for motivational enhancement therapy again. Now let's look into the process of motivational enhancement therapy. It has 4 important process. One is engaging with the client. Second one is focusing the issue at hand, negotiating agenda. Third one is evoking self-sustaining talks versus change talk. Finally, the planning. The planning will be SMART plan to be developed. Let's discuss each one of them. First one is engaging. In engaging, you will be using 4 important core skills. One is open questioning rather than closed-ended questions, affirmative action or words to be used towards the client's behavior or his past behavior, reflective listening, and finally summarizing what the client has told so that the client understands that the therapist is doing his best to understand his problem. This is very essential for engaging the client in behavioral change. Let's move into the focusing. Here, you're bringing which need to focus on the agenda. What is that agenda? Will be discussed by ask, tell, ask approach. What is this ask, tell, ask approach? Here, you will be focusing on certain behavior. You will ask the permission. Can we discuss on your diet? And you should ask him, what do you know about your diet intake? What are the issues in this? Then you can start closed-ended questions. By any chance, when you are asking, he refuses to discuss about diet, do not move forward with regard to diet. Invariably, you need to ask him to choose an area where he wants to bring in change. Once he brings in that I want to quit smoking, then you need to ask about what are the difficulties he's facing in quitting smoking, how he would like to bring in change. And here you have to tell next step, the information regarding smoking, giving feedback about his smoking, and you may have to give some advice. And finally, you need to listen, appreciating his courageous behavior, reflect about his thoughts and emotions of the client, and summarize. So, this technique to be adopted rather than confronting the client. In motivational enhancement therapy, similar to motivational interview, you're not going to give lecture, you're not going to confront the client, you are going to help the client to discover his problems, uncover his intrinsic motivation to change, and the client needs to argue for change rather than therapist telling you need to change. That should not be there in motivational enhancement therapy. Let's move to the third, evoking. Here you will talk about focusing on change talk rather than the sustaining talk. What does it mean? In change talk, invariably the client will be discussing about he wants to change, that is desire for change. He may discuss that he has an ability to change, but he is finding it difficult. And he may give reasons for changing, need for change, and slowly moves towards the commitment towards change, activation of the motivation, taking step, and finally the behavior change. These steps is called darn cat. So this is the mnemonic to remember for evoking step. And finally, planning. Without planning, the motivational enhancement therapy will fail. In this regard, you need to collaboratively discuss about SMART plan. What is this SMART plan? If there is no goal, then invariably it will fail. Whatever the motivation or inspiration you have brought in, it will fade off. If you have specific action plan, there are greater opportunity to succeed. In this regard, you need to have an action plan which is SMART goals. What is SMART goal? Which is specific, measurable, attainable, realistic, and time bound. For example, if the client says he wants to be successful in his life, that is what is his goal. But invariably, being successful is very difficult to measure. What is that specific success is different to different person. Is it attainable in a time bound manner? It is simply impossible. You need to break down this success. You need to ask the client, what does he mean by success? He says, I would like to have a job in his life. Now, to have a job, what he has to do as a first step? He will say, he needs to apply for job. That is the first step. You need to have a goal. Applying for job, which is a specific goal, which can be measurable, how many applications, how many interview attend, and it is attainable, it can be realistic, and time bound. Realistic here, he should not be asking for a job which is beyond his educational status. Hence, it has to be realistic goal. If he has passed engineering and he needs to get a job in engineering based upon his competency, he need to look for the salary. So that realistic is very essential. Hence, the SMART goal is given here. And in this process, you will also use this visual analog scale. And you will be asking, how confident are you about the plan to take action? What changes are you considering? How important is it that you make the change to get the job? How confident are you that you are able to make the change? And finally, how ready you are to make the change? Asking him to mark between 0 to 10. 0 is he does not have any motivation. 10 is yes, he is motivated to change. If he says 4, then you need to ask, why did you pick up the number 4? You had an opportunity to choose 0, 1, 2, 3. And when he says 4, he needs to argue for his change at the level 4. That means you are slowly uncovering him to bring his change in his behavior. So that is how it is done. Now let's look into the predictors of outcome in motivational enhancement therapy. The positive predictors are if the therapist has accurate empathy, as defined by Carl Rogers and his students, which shown to be a powerful predictor of outcome, good outcome. What is accurate empathy? The therapist's ability to deeply understand the client's internal world. That is, therapist's ability to understand the client's internal world and accurately perceive the client's thoughts, feelings, behaviors, and experiences from the client's perspective. If you are able to do this and express that you are able to empathize what the client is going through without a non-judgmental attitude, complete non-judgmental acceptance should be there, and then showing empathy, the client starts working towards his behavioral change. What are the negative predictors? The degree to which the therapist engages in direct confrontation with the client will leads to poor outcome in motivational enhancement therapy. So never confront the client, do not give lecture, do not ask him to change. The client has to argue for his own change, and he needs to invoke his own motivational argument for change. That means the client has to work towards it rather than the therapist asking him to change. That is very essential. That is the reason the negative predictor is never argue or confront the client. Now let's look into the motivational enhancement therapy in substance use. Very interesting article published in Indian Journal of Psychiatry, The Brief Intervention for Substance Use Disorder. Siddharth Sarkar and his colleagues have published this. Please scan this QR code to learn about the motivational enhancement therapy, or also it can be considered as a brief intervention for substance use disorders. They have given various techniques and also discussed about frames and dares. Now I will be discussing about them. First and the foremost, before you start the motivational enhancement therapy, you need to do screening and to check at what level the client is there. Is it harmful use? If it is there, harmful use, you need to look for brief intervention, and then how serious is his problem, or else there is no harm is there, then no specific intervention is required. If the substance use is very serious, check whether he is in a dependent pattern or whether it is a harmful use. So in this regard, the Sarkar and his colleagues have clearly told that brief intervention or motivational enhancement therapy to be used in harmful use invariably, whereas dependent users in rehabilitation period, motivational enhancement therapy can be used, whereas motivational interview should be used only in harmful use. Now let's look into the frames. This frames model, which is used in motivational enhancement therapy, the mnemonic is frames. F stands for feedback, R stands for responsibility, A for advice, M for menu of options, E for empathy, and S for self-efficacy. Let's discuss each one of them. Feedback. Once the assessment is done, you need to give feedback about the recent medical investigation, and you need to discuss whatever the here and now problems. You should not do a prospective guessing that if you continue to drink, you will have cirrhosis, you will have liver cancer. That should be avoided. That is giving lecture. Instead of that, you have to say that if you look at your blood test, it clearly indicates that there is something wrong in your body. What are the possible reasons it may be? Ask the client. Once the client gives his explanation, you may have to give feedback telling that the possibility, what I can understand because of my medical education, I can give it is possibility maybe alcohol use is the one. By giving this feedback and telling him what to do for the next may be considered here. Now, when you say what has to be done, the responsibility of change has to be on the client rather than you telling him to change is to be avoided. Here, you have to tell the decision to take or not to take substance is left to you. I am here to help you to find your goal. By doing this, you are giving respect to the client, giving complete autonomy, and also telling him that we are here to help you to succeed in his life and to achieve his goal rather than focusing on substance use. This improves the motivation, rapport, and this will help the client to focus on short-term goal and long-term goal. Advice. This component aims to make the individual aware of his potential harm of continuing to substance use. And this advice, many a time, if the patient is very sensitive or certain behavioral traits are there, we have to be very careful when we are advising. This has to be based upon the current behavior, and whether the client is ready to receive advice has to be assessed. If the client is not ready, you should not give any advice at this point of time. However, in frames, it talks about advice. But measure your words when you speak to the client. Menu of options. To further strengthen the motivation of the person to reduce or stop substance use, one has to provide alternative strategies and solution which will help him to overcome the unwanted behavior. Based upon past history of relapse, the menu of options can be chosen and given to the client. Let the client decide whether which one to choose or he would like to postpone the change in behavior. These are the various strategies which can be given. One is learning to identify the high risk situation and learning the coping mechanism to handle. That is, refusing skills can be taught. Develop over a productive social activities, hobbies, sports, and music can be given to him. Strengthen social support. Read through self-help resources and gather information, giving him manuals or information booklets, maintaining diary of substance use, using money for other purpose rather than using for substance. Information regarding other counseling services can be given to the client. Empathy. One of the most important aspects of delivering brief intervention is to provide empathy and reflective counseling. By doing this, the patient will be able to understand the therapist has a non-judgmental stance, and an alliance will be developed between the therapist and client to bring in the change in the unwanted behavior. The therapist need to focus on self-efficacy, improving the client's self-esteem, and make sure the client is confident in stopping the unwanted behavior. The next important is DARES model for motivational interview. Here again, if the client is very sensitive towards advice, you can choose this model. That is DARES, D for develop discrepancy, A for augment ambivalence, roll with resistance, express empathy, and support self-efficacy. Here the advice is avoided. So let's go through develop discrepancies. Developing discrepancies means you need to ask the client where they are at this point of time and where they want to be in life. Invariably, the client may say, I wanted to be a successful businessman. At this point of time, I am a failure. That means where they are and where they want to be. Now, these discrepancies need to be highlighted so that the client wants to move towards a successful person or a successful businessman. This aims to develop an incongruence between the patient's wants to attain in life goals and well-being, and how slowly over a period of time this substance use is one of the behavior which is impairing him to reach to become a successful businessman. Augmenting ambivalence. Augmenting ambivalence aims to increase the cognitive dissonance from the patient's point of view about the benefit and harms of substance use taking and behavior using decisional balancing. In this process, avoid argumentation with the client. You need to focus on the ambivalence, whether he wants to change or he does not wants to change. See for the change talks or status quo words he is using. And you need to focus more on the change talk, desire to change, want to change, and capability to change. Those are the words we need to focus on that and improve his self-efficacy. In this process, what are the benefits of substance use? What are the adverse consequences of substance use should be discussed, which the patient himself will tell and ask him to choose where he wants to go. And in this process, roll with the resistance. Patients invariably will show resistance whenever you give lecturing. Hence, you need to avoid giving any lecture or confronting him about his behavior. Hence, do not give any kind of lecture to stop the behavior. You need to look at his ambivalence to stop the drug or resistance is there. The therapist need to acknowledge and accept ambivalence and resistance is normal and it is not pathological and is explored openly with the client over a period of time. Solutions are usually evoked from the client rather than the therapist giving the solution. That means you're not going to give ready-made counseling sessions telling that these are the best way to go about change. No, it is the client has to find what are the solutions for him which will work for him. Here the change is brought through the client's own voice rather than the therapist giving the change. That means the client need to argue for his change rather than the therapist arguing for the patient's change. That means it is intrinsic motivation to be evoked. You need to express empathy toward the patient's struggle, acknowledging the patient's current condition, empathizing the fact that quitting substance is not so easy, it's very difficult, and he has tried in the past, he had made attempts. Those are the essential things to provide empathy in the client. And finally, support self-efficacy. Many a time, the clients would have giving up telling that I can't stop alcohol and it is simply beyond my capability. Hence, you need to take the patient's past history, look for his success in the past, his capability in the past. You need to enhance his self-esteem. You need to focus on reflective listening, shifting the focus, giving praise statements to strengthen his self-efficacy, and use open-ended questions, especially when resistance is encountered because of poor self-efficacy or poor self-esteem. And many a time you have to do a supportive therapy or supportive work during this process. So this is, my dear friend, dates and frames. To conclude, motivational enhancement therapy is a structured, time-limited approach that strengthens intrinsic motivation to change his behavior. Motivational enhancement therapy is to enhance, maintain, and consolidate the motivation to change the unwanted behavior. It emphasizes self-efficacy, autonomy, and relapse prevention in the client. It is time limited, 4 to 6 sessions, and each session lasting for 45 to 60 minutes. And in this, motivational interviewing is one of the component of motivational enhancement therapy. Invariably, many of them, that is researcher and clinicians, believe motivational interview and motivational enhancement therapy are both the same. No. There are slight modification which Williams has brought in along with Rolnick, that is motivational enhancement therapy. And hence, you need to use both these techniques, frames or dares. Frames can be used when the client is ready to receive advice. If the client is not ready to receive any advice, then you may have to choose dares. That is, develop discrepancy, augment ambivalence, roll with the resistance, express empathy, and support self-efficacy. By doing this, motivational enhancement therapy, you can change the unwanted behavior and help the client to reach his goal. Thank you very much for giving your valuable time. Stay safe.